Another component that I find really interesting is your take on curiosity and how, generally speaking, within society, curiosity is seen as a very positive thing. Be curious. Can you talk to me about how that's overlooked in the medical space and even within med school, how it's a negative connotation?
It's kind of interesting. I think good clinicians and good researchers are always curious. I mean, it's really a precondition because you see something, you think you understand it, you open your mind to the possibility that you don't really understand it, and then feel some kind of impetus to need to understand better. And that's really kind of so it's this process of perception and then allowing yourself to feel uncomfortable and then um, and then having in the back of your mind that there is the possibility of wonder.
Mm.
And and so I think that that's how new drugs get invented. That's how new diseases get named and described. And that's also how you provide personalized care. So, for example, as a family doctor, I took care of a lot of people with diabetes. Diabetes is a very, very difficult disease to live with. You have to keep to a diet, you have to keep to a regimen. You can't enjoy some of the same things that your friends do. You have to take medications that sometimes don't make you feel any better and actually may make you feel a little bit worse. Um, People generally feel better when their blood sugar is on the high side. And so when you lower it, they don't always feel so good. And so after a while in practice, um, I kind of felt like I kind of had assimilated all that I could about the medications to treat diabetes, the types of diabetes. But the thing that really kept me interested in taking care of patients over time, because I would take care of people for years and decades, sometimes with diabetes that was not very well under control, is trying to understand, well, who is this person with diabetes and why aren't things going the way they should? And then I'll discover that this woman with diabetes has 6 children. Two have to be gluten free. One's a vegetarian by choice. She's on a limited budget. Her husband isn't working. The grocery store is a long drive. Um, and it suddenly makes sense why she is not eating the things that she should be. And then that helps me then create a more reasonable treatment plan for her, with her, I should say. And then I have this kind of aha moment. Oh, yeah, this is what's really interesting about this woman. Her type 2 diabetes is kind of right out of the textbooks like everyone else's in some ways, but her life isn't. And so the curiosity about people's lives and what makes them tick and what they're skilled at and what they're not skilled at, what their strengths are, that then becomes the really interesting part of primary care practice. And so that if you don't have that kind of curiosity to know people as people, then you begin to burn out. It becomes uninteresting. It becomes tedious. So I think it's really, really hard to be curious when you're angry. And I know that feeling of prescribe a medication, the patient comes back 3 months later, and you notice in their medical record it's not been refilled, and you think, what's going on? And they say, oh, I'm taking my pill every day, but they should have run out a month ago. And so, it's hard not to be annoyed or frustrated. But if you can cultivate this capacity for curiosity and say, gee, this seems like a perfectly reasonable person. Why, why is there this disconnect? Maybe they want to maintain a positive self-image with me. Maybe they have an embarrassing problem that they have trouble talking about. So that curiosity about people when I'm angry or upset, or I think that's the challenge. So going from furious to curious.